Have you been told you have frozen shoulder? For this episode of Ask a PT, I want to talk to you about frozen shoulders. The technical term, medical term for it is adhesive capsulitis. So if you break down the words, adhesive meaning sticky, and capsulitis means inflammation of the capsule. So the capsule of any joint are the ligaments and the cartilage that surround the joint. For the shoulder in particular, there is a lip of cartilage around called the labrum. There's a labrum in the shoulder, and there's ligaments that hold the shoulder joint together. So that's the capsule. We have capsules in every joint, hip capsule, knee capsule, ankle, and so forth. So the capsule of the shoulder gets inflamed. With time, the belief is that the stickiness of the capsule gets stuck, and so we have a frozen shoulder. A lot of the things that we do for it is first pain control. There's a loss of range of motion that occurs, and then over time that loss of range of motion is so severe that it causes severe pain. And so when you get to a painful point is where you probably say, okay, something's wrong about it. So we do a lot of pain control. If you look at a frozen shoulder on an x-ray, the humerus, the bone of the arm, is actually sitting up and forward in the joint space. So the first thing we do is mobilize that shoulder down and back. So we do a lot of joint mobilizations with a frozen shoulder. So the therapist will use their hands to mobilize that joint for you. Another thing we do is we try to calm down the muscles surrounding the shoulder. We may use dry needling techniques. We may use modalities such as electrical stimulation, infrared light, or laser therapy, and soft tissue mobilization. And then we want to strengthen the rotator cuff as best we can. So here's how you can tell if you have a frozen shoulder or you're starting to get it. The first loss of motion, or the greatest loss of motion, is external rotation. So you start to see limitations in rotating your arm outward. That's what we call external rotation. Secondly, the second motion is abduction, meaning coming out to the side and overhead. You should be able to reach overhead. And lastly, it's called internal rotation. So if you take your arm and reach behind your back and see how high you can go, you should be relatively same on both sides. The shoulder is a synovial joint, so it likes to go to end range. So the shoulder needs to be taken to end range every day, at least once a day, hopefully. And we recommend that to anyone. So we're working on the computer all day, or we're always functioning with our arms down here. We never really take our arm overhead, and I recommend that we do that at least once a day. Take your arm way overhead and get to your end ranges for the shoulder. Synovial joints, like the shoulder, love that. They actually get better lubrication. Think of it as oil for your car. We have oil for our joints. It's called synovial fluid, and it fills up the joint when we take it to end range. That's why stretching is such a great thing for our bodies. That synovium fills the capsule up, and it gives it good nutrition and ability to move. If it's so severe and physical therapy is of no use, there is a procedure they'll do called manipulation under anesthesia. We don't want to go there. That's our last ditch state. We don't want to do that. If you are starting to see a progressive loss of motion, okay, start working on that at home. If you need help, we're here for you as physical therapists. Ask your PT or go to your PT or come to us and get some treatment on it before it gets really bad. All right, I hope this helps, and we'll see you at the next video.